A paramedic was forced to have his eye removed after his contact lenses were infected by a parasite. Andrew Carthew, 59, from Wadebridge, Cornwall, woke up with a weepy eye in June last year but assumed he just had conjunctivitis. But the following evening, the father of two suffered pain and a sensitivity to bright light in his left eye and went straight to hospital. After being diagnosed with an ordinary eye infection, the paramedic of 37 years was forced to lay at home in the dark as medication did little to improve his condition. Doctors then revealed he had acanthamoeba keratitis a month later, an infection caused by an amoeba, a parasite found in almost all soil, fresh and seawater. Months of treatment helped to fight the infection, but it returned after Christmas, leaving surgeons with no choice but to remove his eye. Acanthamoeba is a genus of amoebae, one of the most common protozoa in soil, and frequently found in fresh water and other habitats. Acanthamoeba has two evolutive forms, the metabolically active trophozoite and a dormant, stress-resistant cyst. In nature, acanthamoeba species are free-living bacterivores, but in certain situations they can cause infections, acanthambiasis, in humans and other animals. Granulomatous amoebic encephalitis is caused by amoeba infection of the central nervous system. It is characterized by neurological symptoms including headache, seizures, and mental status abnormalities. These worsen progressively over weeks to months, leading to death in most patients. Infection is generally associated with underlying conditions such as immunodeficiency, diabetes, malignancies, malnutrition, systemic lupus erythematosus, and alcoholism. The parasite enters the body through cuts in the skin or by being inhaled into the upper respiratory tract. The parasite then spreads through the blood into the central nervous system. Acanthamoeba crosses the blood-brain barrier by means that are not yet understood. Subsequent invasion of the connective tissue and induction of pro-inflammatory responses leads to neuronal damage that can be fatal within days. When present in the eye, acanthamoeba strains can cause acanthamoebic keratitis, which may lead to corneal ulcers or even blindness. This condition occurs most often among contact lens wearers who do not properly disinfect their lenses, exacerbated by a failure to wash hands prior to handling the lenses. Multi-purpose contact lens solutions are largely ineffective against acanthamoeba, whereas hydrogen peroxide-based solutions have good disinfection characteristics. In May 2007, Advanced Medical Optics, manufacturer of Complete Moisture Plus contact lens solution products, issued a voluntary recall of their Complete Moisture Plus solutions. The fear was that contact lens wearers who used their solution were at higher risk of acanthamoebic keratitis than contact lens wearers who used other solutions. The manufacturer recalled the product after the Centers for Disease Control in the United States found that 21 individuals had possibly received an acanthamoeba infection after using Complete Moisture Plus in the month prior to diagnosis. The infection thrives where limescale bacteria are present, but contact lens wearers are at highest risk if they clean their lenses or lens cases in tap water, or if they swim, shower or bathe while wearing their lenses.